I'll go to Senator Roberts, who's got some concluding questions.
Thank you. Dr Deveny, how long has the Consumer Health Forum been active, been incorporated?
About 40 years.
Okay, so it's not a recent thing. In August 2019, the federal government published the Australian Health Management Plan for Pandemic Influenza. Not a little plan. They did consultation over the previous 8 years. And then when COVID broke out 4 months after this was released, they tossed it in the bin. They ignored it completely. Were you consulted in the development of this?
Look, I'd need to take that on notice.
If you could.
I'll check for you and come back to you.
Okay. Thank you. That would be wonderful. Secondly, the DAEN system of reporting and recording injuries and deaths from COVID injections. They were never thoroughly tested in the United States. The testing was called short. Our TGA approved the use provisionally initially without testing and just relying upon the American tests that were cut short. My thinking is that when you're using an experimental gene therapy-based treatment that's new and novel, not tested thoroughly, you would want to be very, very carefully monitoring the reported injuries. We had reported from doctors, I think it's now over 1,060 deaths, and we know also that some doctors were intimidated into not reporting COVID injection deaths. So we know it's underreported, but 1,060 plus, the last figures I saw. And yet the health authorities have somehow, without giving us guidelines, whittled that 1,060 down to just 14 deaths. Is that something you would want to, as consumers, be investigating? The reporting of injuries and deaths?
So what we know in the Australian context is that often consumers themselves don't know where to complain if they have a bad healthcare experience. So let's imagine I have an experience of some health service and doesn't go well. People don't know where to go. Do they report to the person who did it, so the doctor or the nurse, and say, I've got a problem? Do they go to the service, so the hospital, the general practice, the community service? Do they go to the funder, the state government, the federal government, the health insurer? So we know that Australians don't often know how to report accidents and injuries that occur in all of their healthcare, which means we assume things are underreported. People simply don't know where to report any kind of accident or injury. And then the reporting processes themselves often are not that user-friendly. Yeah. We'd love to see better mechanisms put in place, particularly in an emergency situation like this, where Australians know if they have any concern about the care they receive, say in a future pandemic, that there's an easy way for them to say, hey, I think I've got a problem, and for that problem to be noted and then them quickly provided advice about what to do. Separately, of course, it's really important that the government understands, and the Australian public also understands, the consequences of any health situation, because ultimately we all pay for it through our taxes, so we have a right to understand the consequences overall.
That leads me to my next and last question. A lot of the money spent by health authorities and health agencies and politicians and government departments during the COVID response was taxpayer funded, either by a loan that the taxpayers are on hook now to repay or taxes. Do you treat taxpayers as consumers? And are they, okay, because they're paying for the services?
Yep, that's right.
So taxpayers have a friend in you in terms of getting information through a Royal Commission into the COVID injection contracts that Senator Rennick raised just a few minutes ago.
So, as I said earlier, we consider that everyone who consumes health services, either they pay for them, they receive them, they support people who's getting a service. These are the term we use as health consumers, and that's really all Australians.
I want to compliment you. I express my appreciation for your direct and succinct answers. Wonderful.
Thank you, Senator.